Hello?
We can hear you.
Yes, thank you, and I hope you can also see my slides. So I will give you a brief overview of the Europe Speeding Cancer Plan and what we have been doing since the adoption of the plan a little bit over a year ago in February 2021. First, to note that with the Europe Speeding Cancer Plan, we aim to address cancer in an integrated and health in all policies approach, also focusing on the different stakeholders that are required to implement the plan. So both at EU, at national, also regional and local level, and also at different stakeholders, including NGOs and patients. Secondly, we try to take a very holistic approach. So the plan focus on the 4 pillars, as we call them: prevention, early detection, diagnosis and treatment, and also the quality of life aspect of cancer patients and survivors. Besides these 4 pillars, we have several cross-cutting themes. For instance, one on research and innovation, another one on digitalization and personalized medicine, a strong focus also on reducing inequalities and disparities, and also a focus on pediatric cancer. In total, we have 10 flagship actions across the different areas of the plan, and 32 other actions, and a dedicated budget of about 4 billion euro. The cancer plan works also in tandem with the Horizon Europe mission, and my colleague Annika will give a presentation on that a bit later. We also have regular exchanges with the European Parliament and its Beating Cancer Committee, and also the Council. We have, in November last year, also adopted an implementation roadmap, which takes these 42 actions of the plan and takes a more stepwise approach, breaking these actions down to specific objectives for each year, and putting it on a timeline, including also progress indicators, so we can judge whether these actions are being on track and implemented successfully. Now, important element for the implementation of the plan is the governance. This is basically how we work with the different stakeholders, and for that we have set up 3 different groups. The first group is working with member states, and for this we have established a subgroup on cancer under the existing steering group on health promotion and disease prevention. And here we address jointly both the Europe Speeding Cancer Plan and the Cancer Mission with member states representatives, both from the health and the research ministries. Then we have a similar joint group established at Commission level, also again, Cancer Plan implementation and the mission, where we work across the different services in the Commission. In total, we have 23 services involved. And last but not least, we have also a stakeholder group, the stakeholder contact group that was set up under the EU Health Policy Platform. So perhaps I will go very briefly into a bit of detail how these groups work. I mentioned already the subgroup on cancer, working both with representatives of the health and research ministries, addressing both the cancer mission and the plan, and focusing on the implementation of the plan at the EU national level, and to use the member states to advise the Commission on how we can support their national implementation, and also the monitoring of the implementation of the plan, work on recommendations concerning actions and how to improve the uptake of best practices, and also inform all other comitology groups, such as the Steering Group on Health Promotion and Disease Prevention, and the Health Configuration of the Horizon Europe Program Committee. We have had quite a number of meetings. Actually, I realized that my PowerPoint is not current. We are now having actually tomorrow the 11th meeting of this group. And we also have established thematic working groups, for instance, on the comprehensive cancer infrastructures, which are both in the cancer plan and the cancer mission, and also some other groups, for instance, on the cancer inequalities registry. Now, moving on to the Commission side, we have here the Cancer Plan and Mission Implementation Group, 23 different Commission services represented. Perhaps noteworthy that about 50% of these 42 actions in the plan are actually not implemented by DG SANTE, but by other Commission services. For instance, DG Connect, the Joint Research Centers, DG Energy with the Samira Action Plan, but also by DG Taxud in terms of taxation of alcohol and tobacco, or in terms of agricultural policy. So a relatively wide range. Also important perhaps to mention DG Education here, with several initiatives like the Healthy Lifestyles for All initiative, also contributing to the cancer plan. In this implementation group, we work at two different levels. One, the strategic level, there is a configuration at directors level, and then a network of cancer coordinators at operational level. Then moving on to the stakeholder contact group. Again, here, the focus is to engage with stakeholders to discuss, advise, and collaborate on the implementation of the plan. Similar to the Commission group, we have basically two-level organization. We have on one side a General Assembly, which meets at least twice per year. And then we have also set up thematic groups that focus on the four pillars of the plan and the cross-cutting themes. So groups on prevention, screening, diagnosis and treatment, quality of life, innovation and digital, and also inequalities and pediatric cancers. Overall, we have about 350 different stakeholders included in the stakeholder contact group, and the thematic groups, depending on interest and size, range between 40 and 60 members per group. Now, perhaps focusing more on the practical elements of the implementation. On the side of DG SANTE, we are focusing, or the main funding tool that we have is the EU for Health program. And another key funding measure, which my colleague from DG RTD will then discuss about, is of course also the Horizon Europe program, but there are also other Commission funding tools. For instance, when we look at different funding tools available through the DG Education, and also then through the cohesion policy instruments and the resilience and recovery facility. If we go back to the EU for Health program in 2021, we have actually launched quite a significant number of actions and calls for proposals to civil society groups, where there were two waves of calls launching 12 action grants. So all of this has been completed. And these programs are now following the assessment of the applications, reach now to a stage where the contracts are being signed and the grants and the consortia become operational. Just to mention a couple of highlights, for instance, the EU Network of Youth Cancer Survivors, support to HPV vaccination, update of the European Code Against Cancer and its dissemination, a focus on cancers caused by infections, and then the variety of other measures, including also then joint actions with member states. So here the addressees are the member states and not stakeholders per se, where we have launched joint actions to prepare work on comprehensive cancer infrastructures and their EU networking, on establishing new networks of expertise, and also providing support to member states on HPV vaccination and cancer-related e-health deployment. That's essentially in response to the lessons learned from the COVID pandemic, and as well some tenders that have been launched and closed recently. For instance, on the development of an EU mobile app for cancer prevention, and also to prototype a cancer survivor smart card. Now we have already started the implementation of the EU Health Work Program 2022. Under this program, we will be launching 2 additional joint actions with member states with quite a significant budget. The one focusing on health determinants, and another one focusing on the monitoring of national cancer control policies and Europe's Beating Cancer Plan implementation at member state level. 3 calls for proposals to be issued. One already live on innovative approaches to prostate, lung, gastric, and lung and gastric cancers, cancer screening. This is also linking to the work we are currently undertaking in terms of updating the 2003 Council recommendation on cancer screening, and 2 more calls to come out on health determinants, and a second cohort of interspecialty training, where the first cohort, or the call for the first cohort, has already been launched under Work Program 2021. Then also close collaboration with WHO, for instance, in the field of alcohol, with the International Agency for Research on Cancer in several areas. Here, for instance, on updating the guidelines on cervical cancer, but also to contribute to the Cancer Inequalities Registry, and then also with the European Observatory in Health Systems and Health Services that is focusing on monitoring national cancer policies. This is linking to the joint action that has a similar focus. Also to be launched a number of service contracts, for instance, on tobacco control policies, health warnings on the labels of alcoholic beverages, evaluation of the EU Childhood Obesity Action Plan, and also very important, the work on both the cancer survivor return to work and development of a code of conduct on fair access to financial services, so perhaps also known with the terminology of right to be forgotten. Also work is ongoing and will be launched on guidelines on access to healthcare for people with disabilities, including cancer patients. And then we are already starting with an initial evaluation of the Europe's Beating Cancer Plan implementation, with a view to inform a review that will be forthcoming in 2024. So basically, in a nutshell, this is the key focus, or some key elements of implementation of the cancer plan. Thank you.